Hi, I'm Michael Sweet. This is Nursing 774, Psychopharmacology, and today I will be discussing the relationship between magnesium and mental health. Objectives for this presentation. What are the functions of magnesium? Magnesium effect on mental health, psychiatric medication and magnesium relationship, non-psychiatric medications effect on magnesium. The function of magnesium. 1. Energy production, neurological functioning, vitamin D synthesis, hormone regulation, and cell membrane regulation, to name a few. According to Baturi 2011, magnesium is essential to ensure the correct functioning of all human cells. Neurons included, it is involved, among other processes, as hundreds of enzyme reactions, intercellular transmission, myelinization processing, synapse formation and maintenance, as well as regulation of serotonergic, dopaminergic, and cholinergic transmission. Also, several studies have shown its usefulness in neurological and psychiatric diseases. Please review the YouTube video, Functions of Magnesium, for more detailed explanation. Magnesium's effect on our mental health. Patients suffering from schizophrenia, mood disorders, anxiety, and especially depression are vulnerable to low levels of magnesium, which can alter moods, create anxiety, and exacerbate depression. Let's review the YouTube video next for further examples and explanation. Magnesium's link with depression. Baturi 2020 performed several studies which found evidence of low magnesium can exacerbate depression symptoms. The antidepressant action of magnesium is likely to be mediated by several mechanisms. The most important one seems to be the one involving the blockade of glutamate, glutaminergic, N-methyl-D aspartate receptors, NMDAR, interestingly, which are closely related to the fast-acting antidepressant ketamine. Baturi 2020 also states another relevant finding that supports the notion of magnesium's antidepressant properties. He links magnesium deficiency to the dysregulation of hypothalamic pituitary adrenal HPA axis. The antidepressant action of magnesium appears to be at least partially mediated by the modulation of serotonergic system. In fact, it seems that magnesium has a synergic effect when demonstrated with molecules of the selective serotonin reuptake inhibitor SSRI class. Interesting, Baturi also mentioned several report findings suggesting that magnesium is a key modulator in the efficacy of antipsychotic medications, for example, haloperidol, which could directly related to hypomagnesia and even treatment resistance in psychosis. Psychiatric medications effect on magnesium. Haldol and lithium. Haloperidol and magnesium. Haloperidol is classified as conventional antipsychotic dopamine 2 antagonist. Haloperidol is used in the treatment of psychotic disorders, tics and vocal utterances in Tourette syndrome, behavioral disturbances, and aggressive behavior. The mechanism of action. Haldol blocks dopamine 2 receptors, reducing positive symptoms of psychosis and possibly treating combative and explosive behaviors. Side effects of haloperidol include neuroleptic-induced akathisia, drug-induced Parkinsonism, and tardive dyskinesia. Dr. Jabinski conducted research on the relationship between haloperidol and magnesium levels. He stated haloperidol significantly reduced plasma magnesium levels and mentions that haloperidol did not affect any other electrolytes such as calcium or phosphorus. He conducted one study with a sample of 11 patients where baseline magnesium levels were sampled before initiating haloperidol. 8 out of 11 patients had a 0.2 to 0.4 milliequivalent per liter drop in their baseline magnesium levels 2 weeks after starting haloperidol. Botteri, 2020, stated, "There is also evidence supporting his theory that haloperidol lowers magnesium because of the manifestations of the extrapyramidal symptoms such as muscle spasm, tremor, cogwheel rigidity, and fasciculations." He goes on to say, and directly relates low magnesium and the low magnesium calcium ratio imbalance is likely the cause of muscle agitation, which include the symptoms mentioned above. Lithium's effect on magnesium. Lithium is classified as a mood stabilizer. Lithium is used to treat acute mania, bipolar maintenance, and major depressive disorders. Although the specific mechanism of action is not known, lithium has been found to alter the signaling through actions on a second messenger system, which reduce symptoms. The side effects of lithium use is profound GI upset, polyuria, weight gain, and ataxia. Extensive monitoring when using lithium is essential for patient safety. When initiating lithium, monitoring every 1 to 2 weeks until desired lithium levels have been established, and then every 6 to 12 months is likely the frequency that will be used for lithium monitoring. However, before initiating lithium, it is important to establish a baseline body mass index, cholesterol, glucose, and triglyceride level. Lithium has been found to increase magnesium levels. According to Dr. Melrup, 1976, plasma phosphate, calcium, and magnesium was studied in 34 lithium-treated patients, in 42 other psychiatric patients, and in 47 other healthy persons. 17 blood samples were drawn from each person during a 24-hour period. Lithium was given at 10 p.m., and in the next few hours, plasma phosphate decreased compared to the two control groups. In the same period, plasma calcium showed a temporary increase, whereas plasma magnesium was increased during the whole 24-hour period. Lithium-treated patients had a reduced urinary calcium excretion during the night and an increase during magnesium excretion during the day. Whereas no change was found in the urinary phosphate excretion, it has been stated that the elevation in magnesium may be beneficial in odd regulation in addition to medication benefits. Therefore, concluding, lithium has a positive effect on magnesium. Proton pump inhibitors and low magnesium. In relation to magnesium and medication, I wanted to briefly mention one non-psychiatric medication that significantly lowers magnesium. This medication class is known as proton pump inhibitors, which are used in treating gastroesophageal reflux disease, gastric ulcers, and duodenal ulcers. The mechanism of action is proton pump inhibitors inhibit the HK-APSase stage in gastric acid secretion via parietal cells. According to the FDA, 2017, proton pump inhibitors have a profound magnesium-lowering effect that can significantly cause irregular heartbeats and convulsions when not properly monitored. According to the FDA, establishing a baseline magnesium level prior to initiating long-term use or anticipated long-term use of proton pump inhibitors is essential. If patients develop signs or symptoms of hypomagnesia, generally proton pump inhibitor therapy will be discontinued, or magnesium supplementation can be initiated if therapy is essential. One of the biggest concerns is many people are self-treating over-the-counter proton pump inhibitors such as omeprazole, esomeprazole, and lansoprazole. Using PPIs on a long-term basis with no physician supervision places the patient at significant risk for long-term effects of hypomagnesemia. This is especially important in elderly population due to the risk of osteoporosis, possible arrhythmias due to low magnesium, and vitamin D deficiency. Additionally, any medication that causes low magnesium levels has a profound effect on mood, as well as depression. So careful monitoring should be applied. My discussion question would be this: what strategies would be useful monitoring magnesium levels closer in the future?